after I had re-injured my knee. I was down in Mexico on vacation, and I wound up having an MRI down there, and the radiologist said that I had 3 tears in my meniscus. I called, had the appointment, and met with Jason, and I liked the information. And the other thing that I thought was important is, since I had already had that MRI, that you guys would accept it and look at it, and then we could go from there. And I did a lot of research, a lot of background research on the procedure, and it just seemed like something that would work. And you guys were very positive about the potential results, so I scheduled it. The procedure actually was pretty easy overall. I think I was in the office for about 2.5 hours, and it started with taking some blood, which was done on either hand, and then the next portion was the fat removal from my back, which I didn't feel at all. That was kind of easy, very simple. Then I had about an hour of internetting, and then it was the injection into the knee, which was interesting. That was probably uncomfortable. I can say that. It was uncomfortable, but for a very short amount of time, maybe 5 minutes. And then I walked out of the office. Unbelievable. In 3 weeks, I had it done just a little over 3 weeks ago. My knee has not felt this good in probably 2 years, if not longer. I have no clicking, no snapping, no twinging, no locking, nothing. It's working actually better than the right knee. And it's comfortable, which is the most amazing part. I'm not worried about getting up, getting down. I was on the beach the other day. I didn't worry about sitting on the sand and how I was going to be able to stand up. And all of that stuff has kind of gone away, which is incredible, because I've spent the past year worrying almost exclusively about those things. Actually, I've already started to talk to a lot of people that I know that have some kind of injury that is similar to mine, and I've told them across the board it's absolutely something that they should research and just compare. I mean, compare recoveries, compare what the possibilities are as far as what your end result is, and then look at it also from the point of view of, I mean, I was very concerned about the arthritis issues and things like that down the line. I wanted something that I could potentially have done that would not only correct the problem, but really make it better. And for me, this was that therapy, and I would 100% recommend it to anybody. It was great. I think that Jason, who is the person that I dealt with the most, I think he is very knowledgeable and friendly and helpful, because it's a tough decision, especially because it's something that's so new. And I think there's a little hesitation about that. You've heard about surgeries or replacements for years and years, but this is something that is, I think it's burgeoning, but I don't think there's a lot of information out there. So it's nice when you can kind of get that feedback that, yes, it actually does work. We don't know to what extent maybe, but you're going to get something positive out of it. And the doctor, I thought, was enthusiastic, and I think he really believes in it, and I felt like I was in very good hands, and it was worth the try. I mean, for me, I didn't think there was anything better.